Assalamu alaikum and good evening, everyone. I am very pleased to know that today I've got a degree of gastroenterologist from College of Physician and Surgeon. This wasn't my intro. So anyway, so I know I'm last and I won't stand long between you and tea break. So I'll try to be quick as much as I can. Uh, the content or the outline of my presentation is hepatitis situation in Pakistan, which has already been talked about. So I'll not go through into that. But cost of inaction, if we don't do anything right now, what would be the impact on economy and health system? Health and economic effects of HCV elimination, benefits of acting now, and of course the federal government and provincial government's response towards the huge menace of hepatitis C infection, and in the end conclusions. This slide has already been talked about in detail, so I'll move on to the cost of inaction. So if you see here, if we don't do anything, the prevalence would be continuously raising. And by 2035, we'll be having 11 million people affected with hepatitis C. 30,000 years of disability would occur annually, and 350,000 years of life lost will be happening annually. And it will impact death and disability related GDP loss of approximately $3 billion. So what should be needed? This has already been discussed, that we need to scale up our screening, testing, and treatment targets. Punjab is doing a very good job. We have very good public-private partnership models there. They are doing great job, followed by Sindh. But rest of the country, it really needs a lot of improvement. And I think Punjab and Sindh, being the champions in hepatitis C elimination, they can share their experience and their expertise with rest of the provinces and regions, so that they should also follow the same path, and they should also scale up their screening and testing treatment capability and capacity. So expenditure breakdown, we need $350 million in next 8 years in order to eliminate hepatitis. That is 90% reduction in incidence and 65% reduction in mortality. And if we do end hepatitis elimination, we can see that hospitalization is going to decrease down the years. But if we don't do anything, the hospitalization cost and impact on the health system, that will continue raising over the period of time. So benefits of acting now is that if we invest $350 million on hepatitis C elimination, we can easily save 3 billion GDP loss of Pakistan annually. We can save 25,000 years of disability and 300,000 years of life lost annually. Now, Prime Minister's program, this is a huge initiative that is taken by the government of Pakistan with the support of provinces and federal government. In this program, the main objectives are to screen, test, and treat all the eligible population that has already been shared with you, followed by its complementary objectives that will be focused on having an integrated hepatitis information system, which shouldn't be a standalone information system. It will be interfacing with the already existing information systems and dashboard. A robust communication strategy that should be a two-pronged strategy, which will be focusing not only on the demand side, that is the community, but also on the supply side, or which are the healthcare service providers. So that communication strategy will enable service providers also that how they should follow the SOPs and standardized screening, testing, and treatment practices for the elimination of hepatitis C. And of course, The program is based mainly on the procurement of commodities and their supply to the provinces. So we should have our efficient logistics and management information system. So these three complementary objectives are also integral part of the Prime Minister's program. We'll be screening 69 million people aged uh, uh, 12 years and above in next 5 years. Uh, then 5.2 million people will be screened positive, and out of those 4.12 million people will be treated. After screening these 69 million people, we will be having still 102 million people left behind for the next phase, which is for 5 years for hepatitis C elimination. Financial inputs, I will not go into much of its details. As you can see, that major portion of the whole PC1 is based on commodities, which includes test kits, medicines, disposable items. It is almost 95-96% of the total cost of PC1. These are the major components and their year-wise calculation for 5 years. And the total cost for the PC1 is 35.42 billion Pakistani rupees. And the same amount is pledged by the provinces to be, put into the program, not only in the form of money, but in the form of their services, their management, HR, and other work they are doing for hepatitis C elimination, that should be taken as their share for the implementation of the PC1. So this is province-wise allocation. So this is my last slide. So in conclusion, we know we are resource-limited country. We have huge disease burden, and these are the challenges. But the opportunities are that in past few years, we have gained a very strong political commitment, and not only within the country, but also internationally. So this is a great opportunity where we can act together, because hepatitis elimination is not the responsibility of hepatitis program or hepatitis advocates. It can be eliminated only by a coordinated response, which includes blood safety, injection safety, infection control, waste management, and so many other players and actors. So we need to have a coordinated response, and also after being said a lot about hepatitis C, we shouldn't be forgetting other types of hepatitis, including hepatitis B, A, and E. So that's it. I'll stop here, and thank you very much.